apologize. I got headphones to work and now I can't get anything else to work.
Is that better?
Yes, ma'am. I can hear you loud and clear.
I want to welcome everybody to the January 11th Policy and Personnel Committee meeting. Let's start with agenda item number 1.
Thank you, Ms. Lowry. What we'd like to do is talk to the committee tonight about a conversation that's been ongoing for quite some time. We previously approached you in November about the idea about hiring some department grade level coordinators. Okay. Sorry. We talked to you previously about hiring some academic department grade level coordinators back in November. And what we'd like to do tonight, Ms. Lowry, is bring those names forward. It's part of this collective bargaining agreement. And what we would do is prorate their salary. And we're looking to hire at the meeting again later this evening. And the prorated salary would be about $900 for the rest of this year. We already approved the job description, and quite forcefully on my end, I think this will help us a long way with continuing with our literacy efforts, providing some additional support, as this is new to a lot of us. And these people are highly qualified. We think they fit the mold. We think there's a lot of great candidates, but we're happy to bring these names forward. And if it's okay with you, Ms. Lowry, I'd like Mr. Hiron to give a brief 2-minute overview about what some of the work looks like so the committee's aware of it and what the details are, if that's okay with you, Ms. Lowry.
That sounds great. Thank you.
Okay. Mr. Hiron?
Yes, sir. And thank you. The idea behind the literacy lead teachers was to really have that connection with the people who are working with the curriculum every day, and really identifying some potential issues with lessons, materials, instruction, etc., and then acting as a liaison between our leadership team and the teachers to make sure that this initiative that we believe in 100% has every opportunity to succeed. So these people are going to just support the district literacy vision, provide leadership and support to their grade level teams to make sure that they feel supported and they have someone who can instantly help them problem solve or troubleshoot if anything would arise, and then make sure that they are communicating the leadership's vision back to that team. So they could serve a variety of roles, from gathering materials lists to developing professional development, creating model lessons, consulting with their peers, advising on district initiatives related to instruction, assessment. It could be any number of things that we would like to have time to do as administrators, but simply don't, number one, have the time, and number two, don't have the intimate knowledge of the lessons and the dynamics in a classroom to really do effectively and quickly. So that's the idea behind these things, and I think they're going to be a huge step in the right direction to making sure that this literacy initiative is successful.
Do we have any questions from committee members? Any other participants? Questions, comments? All right, this is on the agenda, so we'll move to item number 2.
Thank you, Ms. Lowry. The other thing we're doing this evening is we'd like to talk to committee about requesting permission to add up to 2 reading specialists to this team. They're invaluable to the work we're doing. If it wasn't for the pandemic, they would be doing a lot more of the work and heavy lifting. But right now, they're pulled in a lot of different directions as far as synchronous, asynchronous, and still trying to get all of our kids. But we recognize and realize they offer a lot of value, and we're looking at to add them additionally to this pool of literacy leads in the district. Same compensation, and the job description is hyperlinked on here for you to note, but we think it's valuable to have them part of the discussion, help doing some of the work and heavy lifting and leading with us. And it has our support. And Rob, anything you'd like to add to that I may have skipped over?
No, that's it. I mean, it was really my fault. I should have had them included in the initial job description and job placement, but just an oversight on my part. They're such a valuable piece that I kind of took them for granted, and just when I made the positions, we just did the the grade level teams, and kind of overlooked the value that those experts add. And although our MTSS team is phenomenal and they understand the data and they understand MTSS framework and all this stuff, they lack the certification of the reading specialist. So, it really does add value. So for the same, the same price and the same compensation, the same time commitment and job description, we're going to add some experts to this team as well.
Okay, thank you. Any comments, questions? Okay. Sounds like we're making pretty huge strides when it comes to our literacy program and adding to that. So thank you. Item number 3, long-term substitutes.
Yes, ma'am. Later on this evening, you'll address some long-term substitute positions at the board meeting. Junior high 6th grade teacher that we're going to retroactive till December 11th, an East Pike teacher, and as well as a senior high school counselor for a 2nd semester, which we'd like to start that person immediately to allow for some continuity of planning and services to the students. Pretty straightforward, but we thought we'd at least bring it to your attention and see if there's any questions that you'd like us to address.
I don't have any. Help me understand the senior high counselor. Is that an additional position or is that a replacement?
Yes, ma'am. It's a long-term sub. We have someone taking off the 2nd semester for medical issues, so we're bringing in a substitute for the second semester, ma'am.
Okay.
That's all.
Yep. Anybody have any questions, comments? All right, then we're going to move on to item number 4.
Thank you, Ms. Lowry. I'd like to turn it over to Jared. Jared is the one responsible for helping us lead our good work at IRMC in the area of health and wellness, and I think he's bringing forth a contract for the board's consideration tonight. With that said, I'll turn it over to Jared.
Yes, thank you, Mr. Vukovic. This is probably the 4th or 5th year that we have been contracting with IRMC to help manage our employee wellness program. As of right now, employee wellness is part of all of our employment contracts. It was put in there as an effort to help keep our employees, sorry about that, well, and they work directly with us. They help us create the program, which is part of a committee of both employees, administrators, and IRMC sit on that too. So they bring a wealth of knowledge of what other companies and everybody else are doing with employee wellness. They also manage the platform that we use to track as employees complete the different components. But they also take the data and drill down to where they see our needs and where we can help our employees improve. And that's something that as the employer, we cannot do. We can get the general overview, but if there are issues with individual employees, IRMC has the ability to actually reach out to those individual employees who may have a health issue that they're not even aware of, but comes out in light of our wellness program. So they, just in summary, they do bring a wealth of knowledge and experience and ability to continue to help our employees. And this contract is just for their management or support of our wellness program in 2021. There's kind of a fee structure as part of it. As they, provide the different services, that's how we pay them. There is no set one fee. It is just as they provide the different components. And then that also depends on the participation that we have in our wellness program, because it's really it can be an hourly fee, it can be a session fee, but we do have a budget amount in our budget already to help cover this. The last couple of years, we have not passed that amount. So we do a good job of helping, working with them to manage their fees as well. So it is just on the agenda tonight for approval for the 2021 program.
Okay. I think it's valuable that we are able to offer this, and it sounds like you're working with the participants and IRMC to make sure that we keep our costs in check. So
Yes,
thank you for that. Questions, comments? All right, we are moving right along. Second reading of policies.
Yes, ma'am. These policies we started in October, November. I'm thankful that you allowed me to cancel December's meeting because I needed time to update it with all the feedback that I've gotten, and I think they're reflective of such. So tonight would be the second reading, Ms. Lowry, for the committee and for the board to consider this evening.
I want to thank you all for the committee, the board members who provided feedback, and the administration who made this happen. The only suggestion I have is for policy 252, if we can consider calling it relationship violence rather than dating violence. Our students don't refer to their relationships as dating. And I think if we use language that they don't understand, they may think this doesn't really apply to them. And then I know we had some discussion about at what grade should we start some of our educational programs. And you know, I'm okay with grades 7 through 12, although I do think that we may want to start that conversation in our 5-6 buildings.
Yes, ma'am, we can make those changes to the naming, and then what I could do, if it's okay with you, through academic committee meeting, we can start exploring that further and then make the changes. I can always go back and make an update if that's okay with you, Ms. Lowry.
Yeah, I think that sounds good. Anybody else have any comments, suggestions on any of the policies? Okay. Then we have first reading of some policies.
Yes, ma'am. These are some updated ones and some newer policies that really, a lot of them are related to the pandemic, changing some language, making sure it aligns with the times that we're going through right now with regards to pandemic. The one that I'd like to call out is the health examinations and screenings. What we're asking is for the board to look at considering making a modification to our plan where we accept private physical and dental exams performed 1 year prior to the start of the school year in which they are mandated. Right now it's 4 months, but we think this is more considerate to our families and more beneficial to them as they see their PCP every year, right? So, you know, our families often have constraints of insurance coverage for well visits, also issues with lost time from work, etc., additional expenses, and added paperwork for these practitioners. So what we're asking the board to do, which a lot of schools do, is to take that from 4 months prior to opening a school term to 1 year. And we think it makes sense for us. We think it's fair to our families, and it still doesn't put us in a position where we're concerned about the safety or wellness of our students meeting these, you know, these exams. We're just giving a little bit of grace and considerations to the families, and it has our support, Ms. Lowry.
Okay, I was confused because it said the state requires 4 months, but this is a local decision that we can say we'll accept up to a year before.
Yeah, basically we have to write a letter to the Department of Health and they'll approve it. And prior to my arrival, I would say almost 2 decades ago, there's a letter sent in the Department of Health. We just need to follow through and really solidify everything on our end. But this work was started prior to me. We're just really kind of formalizing it and following through the way we should. And that means updating our policy to reflect that letter that we previously sent. What I'll do, Ms. Lowry, just to be even safer, if you're okay with it, if the board considers this first reading after the second reading, it becomes official, then I'll send in a new updated letter to the Department of Health just to make sure everything is on the up and up. It looks like it was started prior to my arrival. And I think, Ms. Lowry, I want to say almost a decade or two ago,
okay.
We just never followed through. And this is just really falling through. And it makes sense to us, to me, when I looked at it. And I think it gives some consideration to our families as well.
Okay. Anybody else have any comments on any of the other policies? I have some. I know you're not surprised. For policy 331, I think because sometimes we do have folks that travel out of state, we should make it clear that we're following the GSA rates for meal reimbursement if travel is longer than 24 hours, minus the 3 exceptions, I think, that are stated. I do think we need to look at and put in there that their travel reimbursement needs to be submitted within 30 days of travel. If you wait until the end of the fiscal year, 30 days after the end of the fiscal year, you're actually not supposed to be able to reimburse that as travel. After a certain amount of time, it has to get reimbursed as compensation, and we certainly do not want to do that. And the traveler does not want us to do that because they will get taxed on that amount.
Yes, ma'am. I can make those changes prior to second reading if you're okay with that, Ms. Lowry.
Yep. And then I've got a couple of concerns on policy 334. We may just want to check with the HR folks. I don't believe that you can keep medical or sick leave documentation in the same file as personnel files. They actually need to be in a separate location. So I want to make sure that we're not doing something that if we were to have an HR audit would get us in some hot water.
I'm making notes and I can do that tomorrow, Ms. Lauer.
All right, sounds good. I don't have any other comments. If as board members, if as you all read the policies again or take a look at them, and if you find that there's other things we need to consider, you can send me changes or suggestions by next Monday, or give me a call, then I can pass those along to Mr. Vukovic.
That sounds perfect, Ms. Lauer.
Item number 7, principles for governance and leadership.
Yes, Ms. Lauer, as you and I talked briefly via email, we thought it was important to really bring this forward tonight, as it's Board Recognition Month, and part of Board Recognition Month from PSBA asks us to look at our framework and our values and our vision and reconsider and reevaluate what we're doing and reaffirm our commitment to these values and these principles. And I think it's timely. I think it's an important thing to do when you look at what's going on across the nation. I think good government matters more than ever, and so does good governance. My comments tonight during the Superintendent's Report will hit home, I think, on some of these issues that our country is facing, but let's worry about what we can control. And I think what we can control at our level is good governance. And I think these are just nice guidelines and a nice framework for us to operate and lead ourselves by. It was developed by the PSBA to increase board effectiveness, and I think it helps us shape our vision and remind ourselves of what good behavior looks like and what good governance looks like. And Ms. Lauer, it doesn't mean we all agree. It just means when we dissent, we do it with dignity. Right. And I think that matters. I think good governance matters. I think it means being good listeners. And sometimes too often in society, we look at dissent, meaning you're disloyal, where I think we can dissent with dignity. So again, I'm just bringing it forward for the conversation. If the board would like to have it, we've done this in years past. And I think it's timely when we look what's going on across our nation, because after all, in my opinion, our kids are watching us.
Mike, I agree. I also think it's important that we do this in public to perhaps help clarify for some of our media friends that like to put folks in uncomfortable positions. You know, part of the principles for governance and leadership says that we may not always agree, but we are always going to support the motion that you know, comes out during the committee and when we vote. So I think it's important that we also let our public and our constituents know that these are the model, this is the model under which we're going to operate.
Yeah, and the only thing I'll add, and I'll say about the rest of my comments from my Superintendent's Report, Ms. Lowry, is I think it's important for the public to really hone in on the idea or the topic of transparency. What you as a committee and as a board do and function in every day when we meet is far beyond, in my opinion, what most boards do. For example, and I'll cite some specific examples, the meetings are held in front of the public, not with the public. However, this board has been really committed to giving a unique opportunities for our community members to have input and have say. And I think that goes much to your credit. But when we have these discussions and they're in front of the public and they may be difficult, it doesn't really negate us of our responsibility to have them. That's one. And two, I think when you talk about the issue or the topic of transparency, what you do in public when you have these fierce conversations and difficult conversations, that's the very essence of transparency, Ms. Lowry. And I'll save the rest of my comments for this evening.
Okay, thank you, Mr. Vukovic. Any other comments? Board members, community members, teachers? Okay. I see we have some employee retirement.
Yes, it's with deep regret that I bring forward Greg Trout's retirement. We knew about this since I started here, that this is the window or time frame that he was going to go out. It's going to be effective July 6th. It's a big loss to the district. He's an amazing person, and we'll save the rest for the day he does retire, and we can save those all those wonderful adjectives and superlatives about him because he's that amazing. But what we're asking tonight is two things. One, for the board to accept the resignation effective July 6th, and then allow us permission to advertise/post for the position and start that process, as we want to make sure we have time to make sure there's a smooth transition. Next on the list, we have Mr. Joe Sokol retiring from driver's education. Again, I'd ask this committee to accept the resignation this evening, or this board to accept the resignation this evening. And then an academic committee meeting, the board can discuss what options they want to go as far as driver's ed, keeping it, looking for other avenues or whatnot. I don't think tonight's the conversation, other than I want to make you aware, Ms. Lowry, of the two retirements. And in particular, they're both incredible individuals, but Greg's been instrumental as far as keeping us open and keeping us safe during all the time, but especially more so in the pandemic. And he's going to be deeply lost, Ms. Lowry.
I would just like to reiterate that I want to see us do a very broad search for this position. While some of our other positions are have a much smaller candidate pool, I think that we have an opportunity here to really broaden our search from what we typically do and make sure that we cast a wide net and find someone who can continue the good work that's been going on.
Uta, this is Tom. I was hoping this was a misprint. I think Terry and I are going to retire on July 4th. We're severely going to remiss Greg. I'd also like to encourage the administration to hire somebody and make sure there's a couple months of overlap if that's possible. The amount of stored knowledge that Greg has that needs to be transmitted is just immense. So let's not bring somebody in September to this position as quickly as we can get somebody in. And if we have to, and we should be paying the new person in parallel with Greg for a month or two, if we can possibly pull that off.
Tom, you echo what I was going to say too, and I'm not going to support the motion that for his retirement. I mean, Greg's a better person than
Terry, we're having a hard time hearing you.
And his knowledge and stuff too. I'm sorry. I'll talk later.
Okay. I mean, it sounds like it's definitely going to be a loss for us, but I wish him all the best and know that this is the best decision for him, and that's great.
Okay. Next, under non-agenda items, there's two items we'd like to talk about with the committee. One is an agenda item, and if you want it to be, and I'll explain that in a minute. First, let's talk about reopening. At the academic committee meeting, we had some conversations about third grade. I was concerned about third grade being maxed out. It's been settled. Mr. Banny, Mr. Springer have done a good job making that work. We double-checked that with the code officer here in Indiana, as well as our architect, and we're good for now. So what we're going to do is stay the course. We're okay at this point. Kindergarten is next on the watch list. Again, we're okay for now, but it's next as far as almost reaching capacity. And it's not to brainstorm or solve anything, because we don't need to at this point. It's more so for me, at least put it on your radar, that it's a concern. We're going to continue to watch it as far as our spacing, but we're okay right now. And the other thing, Ms. Lowry, again, and we can always continue this conversation. We don't have to answer it tonight, but here's my thought. You know, last meeting in academic, we were trying to find a milestone or a timetable as far as when we should reopen. And I was looking at months, I was looking at different measures and metrics. And then what I would just bring forward for the committee's discussion or in consideration tonight is, what if we just waited until everyone who wants to receive the second vaccination for COVID-19 has it? That would be a good milestone. Now, I can't tell you, Mr. Lowry, when that is, February, March, I don't know. But maybe what I thought was, with this, it's pretty simple to communicate. It's pretty easy for people to understand. And it puts everyone in a safe and a good spot, meaning our students, meaning our staff, and our community. So once people who wanted to get the vaccination have the second one, then we'll fully reopen our doors, meaning we would end the hybrid and we'd fully go back to that new normal, or that normal we had before COVID set in. I think it makes sense. I think it's in the best interest of everyone, and I think it's fair to everyone. Only thing I can't tell you, though, Ms. Lowry, is when that's going to happen, and we'll see. Just like many schools, we're going to sit back and wait and see. But as you see what's going on in the federal government right now, there's a lot of conversations about, look, does this plan work the way we're doing vaccinations? Should we get more out there? And they may not. I don't know. But what I'm trying to do tonight, Ms. Lowry, is bring forward another option for this committee and this board to consider as far as reopening, because I know some people in the community may be eager to do it, and this would be an easier milestone for all of us to communicate. And, you know, once we've done that, I think we've done our part to keep everyone safe. And with that, I'll defer to you, Ms. Lowry.
I was just going to say, I did some research on this over the weekend, and it seems that their immunity takes several weeks after the second vaccine shot is administered. And so if we come up with or ask for an opinion of what several weeks means, is that 3 weeks? Is that 4 weeks? That would also allow us to provide notice to families and have families plan. The only time I don't think it would make sense is if that time is, May, and we're completely, upsetting the apple cart for 3 weeks of school. To me, that probably does more harm than good.
I agree.
But I think it's realistic to have some kind of a milestone, even though we don't have any control over when that is.
Yeah, I agree. And the only thing, Ms. Lowry, I'd like to bring up, and again, we could talk more in academic committee meeting, but I don't know if I'll get to pick the date when they come to administer the vaccine. So what I'll probably do in that day, Ms. Lowry, is make those remote learning days, 100% remote on those days to accommodate. Now, if we can get lucky, I would love to see us get vaccinated February 10th, 11th, and 12th. 10th is a Wednesday, so secondary is already at home that day, and the 12th of February is an in-service day. So if we're lucky and we can get that window, that would help us really, limiting the amount of days we're remote. And then in March, the middle of March, we also have an Act 80 day. So we'll see. We'll see where it comes. That's what we're targeting. Doesn't mean it's going to happen because I have not really got much information from CVS or Rite Aid. I have been in contact with 911 Center. They've been helpful as far as explaining what this could look like and when it can come down. I would fully expect, and I could be wrong, but I would fully expect that even though CVS and Rite Aid are responsible for administering the vaccine, that they would have to do it on our site. And I don't know if that's going to happen or not, but we'll wait to see. But I just want to, get your input and the committee's input and see if that sounds reasonable. Like you said, we'll continue the conversation. But I think after that second vaccination, we can really have a real conversation, like you said, as far as reopening. I think that's a fair timetable for everyone.
Cinda, any thoughts?
Yeah, no, I totally agree. I do have a question, and if it's the wrong time to ask it, tell me. What are we doing? The last time I heard, we've got about 75% of the employees are wanting the vaccination. What are we going to have as a protocol for the 25% who refuse? Are they going to have to continue to wear masks? What's that protocol? And then also, I do want to make sure everybody knows that even after you get the first shot and the second shot, we still have to keep wearing masks. So at some point, the vaccinated people will be able to back off, but the unvaccinated people won't.
Yeah, I think Ms. Cinda's spot on. What we were going to do, and this is just based on my ignorance. Now, in my defense, I haven't talked to our nurses who are really much more educated in this area than me. What I thought we would do for everyone, based on Ms. Uta's comments earlier, was everyone keeps wearing a PPE until we feel comfortable. We talk to our doctors until they feel comfortable not to. So what I would do, Ms. Cinda, after that second vaccination, those who got it and those who didn't, we keep wearing PPE and keep staying that route until we feel a little bit better and safer, until I get some more input from a doctor. So again, I think this is a conversation that will continue, but I'd like to plan with everyone still wearing PPE. I think that makes the most sense right now for us, if that's okay with you, Ms. Cinda.
Absolutely. Safety's first.
Yep. Yes, ma'am.
Mike, said you had talked with some folks and as to who can get the vaccine, and I read somewhere that it was not for anyone 16 or younger. I am hoping that that's similar to what you've heard.
I don't know, Ms. Lowry. I don't want to misspeak. I could double check. My conversation was mainly pertaining to staff. I think you're right on that, but I don't want to misspeak. And what I'll do is by our next meeting, I can have some additional information that I follow up with the nurses. At this point, what we're doing is we did an internal survey. From that survey, we're going to look at how we can get this done in waves to get everyone inoculated and those who want it, but based on a priority. One thing I tried to do and I was turned down was I asked IRMC to get our, and please, they've been great, so don't think I'm being disparaging. I tried to get our life skills and autistic classroom teachers and aides inoculated if they wanted it first, and IRMC does not have that authority. at this time and at this point in time. And I just thought it made sense, right? Those are the kids who may have have some limitations that preclude them from wearing a mask or a face shield. So I wanted to get those teachers and or paras inoculated first if they wanted it, but that was declined at this point. Their IRMC is only authorized to do nurses, which it was offered to our school health services team as well. So we're waiting to see, Ms. Lowry. I know it's not perfect, and I know I sound kind of silly and vague, but I'm only telling you what I know at this point.
Okay, thank you.
Ms. Lowry, I think Ms. Leeper has her hand up.
Yeah, Tamara.
So whenever, Mike, you talked about looking to CVS and Rite Aid for vaccinations, will IRMC be able to help at that point? I know right now they're just able to do nurses. Are they an avenue to explore for teacher vaccinations?
Yes, I think so, Ms. Leeper. I've been emailing one lady who's been incredible with us, trying to keep in touch with them. So I think it may be an avenue. I don't know for certain, but if I know this, they've been nothing but great work with me, talking to me, and I have a call set up with Dr. Shannon to follow up as well. So I hope they'll be a good neighbor and help out if they can. But as soon as I know more, Ms. Leeper, I'll let the board know. But I did ask them, and I will continue to ask them, because my thought at this point is, and this sounds rude, and I apologize, I don't care who gives it to us as long as we get it to our staff, for those who want it. And that's what we're trying to do. So we'll see. My only problem, and then please, I'm not being disparaging about CVS or Rite Aid, but I want to see a logistical operational plan about how they're going to vaccinate 330 employees. I don't see that being done in one day. I don't see it being done at their site. So I think we're going to have to work together on it. So the other day, right before Christmas, or right before Christmas, Rob, Heinrich, and I and Justin drove over to CVS and Rite Aid, and they really don't, no offense, they don't have a plan because they haven't been told what the plan is. So we're going to go over 1 day a week, and then John Pivadori from 911 and I touch base once a week just to see where we're at. And this sounds terrible, but I want to get first in the line, or get our team first in the line as soon as we can, because our kids are counting on us, right? We know we want to open. We know there's an appetite to open, but we're going to do it when it's safe and when it's the right thing to do. And so that's where I'm at now, if that makes sense, Ms. Leeper.
Yes, thanks. I just wanted to make sure that we were looking at all of our options. So thank you.
Mike, I'm just on the CDC site, and it basically says when the vaccine is limited, which is the situation we're in right now, phase 1C is people age 16 to 64 with underlying medical conditions. Then it's other essential workers. And then phase 2 will be other people who want it. It did not give an age, but I haven't been able to find a pediatric health site to look that up. So that may be a question for Dr. Lubold or Dr. Shannon.
Yes, ma'am. I can follow up with them. Yes, ma'am. But Ms. Lowry, is the committee okay then with the second dose as far as our own little internal measure as far as reopening fully then? And I can, work off of my own mind?
I would say we can't open immediately after the second dose, since it's going to take, it says several weeks for the immunity, but shortly thereafter, probably. I just don't know what the recommended several weeks is. Is that 2 weeks? Is that 3 weeks?
Yes, ma'am.
My guess is it's probably not 4 weeks, because they would have said a month.
And if you're okay, Ms. Lowry, I'll talk to our nurses, because I also now I saw on TV, I think people are getting like the symptoms after the second one anyways, so we may have to plan for that, remote days and whatnot. But I'll talk to the nurses sometime between now and our next meeting and have see what I can get done. But I just want to make sure that we feel comfortable with that moving forward.
I think so. Anybody else? Questions, comments?
I do. This is Terry. Can you hear me?
Yep.
I guess I wanted to clarify for myself, but also maybe for the discussion. Doing away with PPE has no relation to vaccination, because even those that are vaccinated can still be carriers and spreaders, correct?
Correct.
Okay. I just wanted to clarify that.
Yeah, the CDC site also says, even though you're vaccinated, you should still continue to wear a mask and socially distance when possible. Tamara.
So what does that mean for the children? Because if children 16 and under can't get vaccinated,
Well, they can't get it right now when the vaccine is limited.
so has it been approved for children of all ages? Because the last I heard, it was not approved for children, and I don't recall the exact ages.
I can't find it right now. I've been looking.
Uta, one of the vaccines was not tested below 16. The other one was tested, I think, to as young as 14, but I'm not aware of any tests younger than that.
Pfizer's vaccine has been authorized for ages 16 and up. Moderna's vaccine is currently authorized for ages 18 and up.
So that means that we're going to have, I'm sorry.
Both companies are doing clinical trials for younger kids right now. So we're going to have kids who aren't able to get it, at least right now.
Right. And I think that my one thought is that I think we know that children around 14, I'm not sure if it goes younger, can spread it. They spread it just as easily as adults. So I would just worry about them spreading it to parents who are unvaccinated if we open fully, because that would, so my understanding is that opening fully would change. The only thing it would change is we wouldn't be socially distancing. We would still be wearing the masks. So I think we need to factor that in our numbers, and yeah, because I mean, it's probably going to be a while, and there's probably going to be a lot of parents unvaccinated.
Mm-hmm.
No, I think those are all good points. And worst comes to worst, what we can always do is when we keep monitoring this, maybe we say, okay, we'll do what we did at the elementary school, give families a choice and make them sure they feel comfortable there. So we have some time, but Ms. Lowry, those are all good points that we can consider as we move forward.
Okay.
If you're okay with it, Ms. Lowry, the next thing we have is, this really is an agenda item, and I made a mistake because I wasn't expecting to get the updated contract so quick. But on tonight's agenda, I do have the updated contract with IUP and the speech and language department, that if we want to continue and expand that partnership, we have the ability to do so. I was asked to get that at the academic committee meeting. I provided the board with the details of the contract. It has my full support. I provided you some rationale that I won't bother reading to you, but provide some rationale as far as what the need is and how it look. In this particular case, we could provide some services at East Pike, and I think that's important. You're looking at about $22,000 a year. So next year, the agreement would be $22,000, but that would bring us 10 people into our buildings, providing some real-time support. In a quick summation, if you ask me, Mike, why is this important? If we're really going to start going after closing that gap that happened after COVID, this is a good way to go about it and really help those early learners to get them on grade level. If our goal as a board is reading by grade level 3, well, then it starts at kindergarten. So we can really do some intense support and accommodate and support what the teachers are doing at the K-3 level. This is a nice way of doing it that is cost effective in the best interest of our kid. And it meets the board's, the academic committee's request of expanding the partnership. So I put it on the agenda this evening for your consideration, because I know their second semester starts relatively soon. And if you don't want to take it now and you want some more time to debrief, we can always do it at the second meeting. But I'll defer to you, Ms. Lowry, but it is ready for tonight. It has our full support, and we are working on a plan to internally roll this out at East Pike to provide some additional support there as well.
Okay. Based on the information that was shared at the academic committee meeting, it seems like we've had a significant positive impact through this partnership. So I think it makes sense to continue. Walter.
Yes, Uta. I have a question for Mike. I get that it's $22,000 for an entire year, but I'm assuming, and correct me if I'm wrong, that if the board approves this tonight, you would bring that additional support from IUP even this school year as soon as possible. Is that correct?
Yes, sir. Yes, sir. That's absolutely correct. In the fall, we paid about $4,680. If we increase it and expand it to the spring, we're looking at a fee of about $8,800 plus a fee for one faculty supervisor, which is $2,400. So for the rest of this year, we're looking at a total cost of $15,880, which I don't think is outlandish. I think it's reasonable. I think it's cost effective. And then the following full year is where it'd be around that $22,000 in cost. But yes, sir, we would be ready. We're thinking we're ready to roll this out in the second semester here in a matter of weeks, sir.
Yeah, that's really my question, Mike, is to see whether this is something we can do right away or whether this is something that doesn't start till next year.
Yes.
I was just wondering, I know IUP is not coming back for the first 3 weeks. They're going to be totally remote. Is that going to have any effect on the graduate students that will be working with us? Will they have any requirement to be remote?
I don't know, Ms. Cinda. That's a good question. That's part of the conversations we'll have to figure out, Ms. Lowry.
My understanding is that graduate students are welcome on campus, and some of their classes have to be face-to-face because they can't do them remotely.
I think that's true as well, Uta.
Okay.
Okay, good. Thank you.
Tom?
Yes, Mike, congratulations on getting this contract in hand in light speed. It's really quite remarkable that you'll be able to do that with the university. I'm so excited to get 10 of these master's students in our buildings. The committee was excited to find to hear about the possibility, and you managed to put this together over Christmas. So congratulations. I think speaking for the academic committee, we certainly support this. And I'm delighted to find that at the time we didn't know what the costs were, but the costs seem to be, I mean, what is that, $2,200 a kid? That's phenomenal. So thank you.
Yes, sir.
Mr. Vukovic, I didn't have a chance to look at the contract. Is this a flat cost or is this cost reimbursable? So are we only paying for what it actually costs, or are we paying whatever the amount is?
I think it is just a flat rate. I'm almost positive, but what I can do, Ms. Lowry, is maybe call Jared and discuss it with him real quick between now and the board meeting, but I think it is a flat rate, I think, but I don't want to misspeak, Ms. Lowry.
Okay, because this is going through IUP and very likely coming through my office, please don't take me abstaining from the vote as not in support of this, but there's a good chance that I'll be working with this on the other end as well. So just so that there's not a perception of conflict, like I don't get paid as a result of this, nor does my office. So, but I just want to be clear that I do support this, but probably will need to abstain from voting on it.
Understood. And Ms. Lowry, the only thing I'd like to bring up to put on the board's radar right now, again, we're not deciding tonight about this part. Again, if we're going to attack this COVID slide that is setting in, I think we need to look at a robust summer programming again. And this would be another partnership. Now, there would be another cost for these folks, but I think it's something, that we could talk about if Mr. Harrow is okay with it at academic committee meeting and continue this conversation, because right now, Mr. Heinrich and myself and just Mr. Zahorchak, our idea is shifting, but all right, now what do we do? Start thinking about summer. Start erasing that COVID slide even greatly. Last year, we got a grant from United Way that provided 100 kids some additional services. Our goal internally is to double that. We'd like to see 200 kids get additional support and services over the summer. Again, don't know what it looks like. All I'm saying is for the committee to start doing is think about it and then understand that whatever solution we come up with, I think this IUP speech partnership is a part of it, and we should expand that into summer. Again, I don't know the details, but I did want to put it on your radar, if that's okay, Ms. Lauer.
Absolutely. Walter, did you have any questions, comments? Your hand is still up.
Well, that's just my absent-mindedness, so I'll take care of that right away. Thank you, Uta.
You're welcome. Tom, yours is too. Did you have any other comments? You're on mute. Okay. I just didn't want to miss anybody.
Ms. Lowry, I think Mr. Croner has something.
Jared.
Yes, I just looked at the contract, and it is a flat fee for the spring semester, and it's kind of based on what we do similar with our literacy interns of a kind of the people who are working are committed to, I think this contract has 20 hours per week for 26 weeks.
Okay.
And Ms. Lowry, that's all I have.
Mr. Vukovic, did you have a comment?
No, I said that's all I have, Ms. Lowry. I'm all done. I have nothing else.
I would just hope that there's a clause in there that if for some reason they're not able to provide services or we are not in need of services for whatever reason, that we don't need to pay the full amount.
And we could double check in that. If not, they've been really supportive and willing and flexible to work with us on these details. So, Jared, if you don't mind making note, we can follow up with them tomorrow if that's okay with you, sir.
Yes, sir.
Is that okay with you, Ms. Lowry?
That sounds great. Any other comments, questions, concerns? All right, well, seeing none, I think we are done at 6:18 p.m.
I'll see everyone next session.
Vukovic, can
Yes, ma'am.
you, under IUP Speech Partnership A, the date was actually 1/4/21.
Oh.
I just want it to look like it took us over a year to make this decision.
And Mr. Heinrich made that mistake with all, if I'm being fully transparent, Ms. Lowry. No, ma'am, I'll fix it. Yes, ma'am, I'll do it now.
All right, thank you.
All right, see you at 6:30, everyone.
Yeah, bye.